Good afternoon, everyone. I think we'll wait just a few more minutes to get some more people on. Thanks for your patience. Okay, I think that we can go ahead and get started. Thank you all for being here today. This is still very odd for me to be talking just to a computer. But thank you for joining. My name is Kelly Jensen, and I'm a psychologist. I work with the Illinois Crisis Prevention Network Support Services team. It's currently really kind of gross outside over here, sleeting and kind of snowy. So I hope everyone is well and staying warm and out of this stuff. Welcome winter. So today we're going to be talking a little bit about Fragile X syndrome. My colleague and I did a presentation not so long ago about autism spectrum disorder and a few of the genetic disorders and how they kind of compare and contrast. And since Fragile X is it is the most commonly inherited genetic disorder, we thought it would kind of be interesting to just delve a little bit deeper into that one in particular. So we will go ahead and get started. Let me switch to presenter view here. Okay. I just want to also say that this is meant to be an overview of Fragile X. Although we are going deeper than before, there's still a huge amount of information out there, and I'm happy to provide you with resources or citations and things like that should you need to explore further. I also want to answer some questions if you guys have them. So feel free to type them in as we go, but I'll just kind of go through the entire thing and then we'll take a brief break, maybe 10 minutes or so, and then kind of come back, reconvene, and go through any questions or comments or anything like that. But I am not an expert in this area. It's all very interesting, trying to learn more about it, but I'm definitely not an expert, but I'm happy to answer questions as best I can. Also, this review includes treatment and research and future direction for Fragile X from a few of the big names and the big sites out there. So just as a disclaimer, there's likely more research out there that I'm not aware of, or we just won't have time to cover today. So I'd like to first go through and define and review Fragile X. I find that kind of knowing what a cause is to something gives me a better explanation, or at least an understanding or a rationale, so I can, oh yeah, okay, so that's why this is happening. It's not just because this person is impulsive or aggressive or what have you. There's a cause to it, and that can kind of help me wrap my mind around it a little bit more sometimes. So we will get into some of that nitty-gritty biological stuff briefly in the beginning. And then we'll go through features of fetal alcohol syndrome, medical conditions, associated behavioral conditions, things that you might see while you're out in the field, things to look for. And then I have a few videos, some case examples, how people found out that their child or they themselves have Fragile X, how they live through it. And then also some treatment options, right? So I'm sure some of us have somebody in mind right away coming into this presentation. John over here has Fragile X, right? So what can we do? How can we best help him and support him? And then looking into future research and resources. What else is out there? What might be coming down the line in 10 years or so? How can we better treat this syndrome as a whole at its core instead of what we're doing now, which is treating the symptoms individually? So this is kind of the big stuff. If you guys walk away with nothing else, this is kind of it in summary. So Fragile X is a genetic condition. It's caused by a mutation in a gene on the X chromosome. So think back to Bio 101, right? So men, if you're if you're assigned male at birth, men are born with an XY chromosome, and women are born with an X and another X chromosome, right? So this is a condition caused by a mutation on an X chromosome, and it can cause a range of developmental problems, including learning disabilities, mild, moderate, severe, even sometimes profound intellectual disability, communication delays, sensitivity to sensory stimuli. It can sometimes affect your physical appearance. And I should say, as I'm saying all of these, Fragile X is almost a spectrum disorder in that sense, where sometimes people have more features of it, or sometimes people will present very differently than someone who also has a confirmed diagnosis of Fragile X, which is one of the reasons it's so difficult to diagnose unless you have some genetic testing. Even just in reading this, what comes to mind first is autism, right? Communication, sensitivity to stimuli, cognitive impairment sometimes accompanying that. And Fragile X is often misdiagnosed as autism spectrum disorder. And it's estimated that 5% of individuals with autism actually have Fragile X. So just something to kind of keep in mind as we're working through these. Also, there are, of course, accompanying behavioral issues that typically correspond with Fragile X. And usually males are more severely affected by this disorder than females. And that comes down to the XY versus XX chromosomes. And I think I said this before, it is the most commonly inherited cause of intellectual or developmental disability that we know of. So work with me here. I wanted to kind of go through the biological bases again. And so Fragile X is an associated condition caused by the changes or mutations in a gene called the FMR1 found on the X chromosome. And I do have a visual next in the next slide to kind of help us work through that. So a mutation on the X chromosome, one tiny little part of it. And part of that gene includes many repeats. So it's common with the DNA sequence to have repeats in notations and letters, right? And so commonly within that gene, anywhere between 60 and 40 repeats is considered normal. Okay, so people who have anywhere between right around 55 to 200 is abnormal. That's too high. And that's called a premutation of the FMR1 gene, right? So you're not super, super, super high, but there is some abnormality there. And so that premutation can cause the gene to not work properly, but it doesn't necessarily cause intellectual and developmental disability. Whereas people with 200 or more repeats have a full mutation, meaning that gene might not work at all. And typically people with 200 or more mutations or repeats of that code on that gene will have Fragile X syndrome. And so here's that visual I was talking about, right? Very biology friendly. So on the left, we have the father who is affected. He has a mutation. I don't know if you can see my mouse moving here, but right here, he has a mutation on his X chromosome, right? And the mother is not affected. She has 2 X chromosomes here. And then in this one, the opposite, right? So dad is unaffected, mother is affected on one of her X chromosomes, okay? I will say the greater the size of the mutation, the greater the symptoms and severity will be. So if you only have 55 repeats, it's slightly abnormal, but it's much less than having 250 repeats, right? And so the severity will be less the less repeats that you have. So looking here on the left again, so men will pass it down to all of their daughters and not to their sons, because in making a daughter, men are giving their X chromosome, right? And so this guy giving his X, he only has one X to give, it's affected. So he will only pass that to his daughter. If he has a son, he will pass on his Y chromosome, and his son will not be affected. So men pass on the premutation to their daughters, and their son receives the Y. So that doesn't include that FMR1 gene. And so they don't get it, they're not affected. Females, on the other hand, so over here, have a 50-50 chance to pass it along to both sons and daughters, right? So they're giving an X, they're always giving an X to their offspring, right? That's all they have to give. Are they going to give this one that's unaffected or this one that's affected? So there's a 50-50 chance to pass it on to both sons and daughters. And in some cases, the FMR1 premutation can actually change to a full mutation only when passed from mother to child. Father, if passing on that mutation, it does not change in quantity. So mom can pass on a premutation and it can morph into a full mutation into their child on that X chromosome. So it can expand to more than 200 repeats on that cell that will eventually develop into an egg, and then the fertilization process begins. This means that women with the premutation have an increased risk of having a child with Fragile X. And by contrast, the premutation in men does not expand to more than 200 as it's passed on to the next generation. Not everyone with the mutated FMR1 gene has symptoms of Fragile X because the body may still be able to make up for that protein. And I kind of wanted to talk about some of the causes of why, or the conditions under which people might have more or less of a mutation. So first is the size of the mutation itself. So some people have a smaller, lower number of repeats, as we said, and others have big number of repeats. And having smaller number of repeats means you're able to make that protein more, right? And so then you'll have milder symptoms. Another reason is the number of cells within the mutation. So because not every cell in the body is exactly the same, some cells might have that mutation and others don't. So if the mutation is in most of the body's cells, the person will probably have some or a lot of Fragile X symptoms. And if the mutation is only in some of the cells, the person might not have any symptoms, or they might have mild symptoms. Another kind of protective factor is being female. So because females have 2 X chromosomes and males only have 1, in females, that gene on that X chromosome that has the mutation, the other X chromosome, might not have the mutation. And so even if one of those genes is affected and has a very large mutation, the body can usually kind of make up for it and compensate and produce more protein, leading to milder symptoms. So here I thought we would kind of go into features that we would see. Now that we kind of understand it, we know what causes it, right? There's a very definitive answer. I thought we would kind of go through features, things that we might be able to notice or see. And again, as we go through all of these, keep in mind, some people might have these, some people might have them very prominently, and other people might not have it at all. But there is a high correlation between these features and presentations with Fragile X. So as an infant, and even young children with Fragile X, they don't necessarily have very specific physical features of this syndrome. They start to go through puberty, however, get a little bit bigger. They'll start to develop certain features that are typical of someone with Fragile X. That can include a narrow face, larger head, large ears that kind of protrude, very flexible joints, flat feet, a prominent forehead, and again, they can become more obvious with age. And so here's just 8 kiddos, youngsters, each with a confirmed genetic result of Fragile X. So you can kind of see that elonged, narrow face. Some of them have larger ears, right? Larger forehead. So given that this is a genetically inherited condition, there's also medical conditions that are highly associated with this. And so people with Fragile X can have obstructive sleep apnea, issues with hearing or middle ear infections. Seizures occur in about 15% of males and about 5% of females with Fragile X. And that also, again, goes back to those inherited genes. Then also there are heart issues, potential kidney issues, GERD, reflux, hernias are also common, feeding problems, eating problems, swallowing, and a lot of that is due to the mobility issues, right? And connective tissue. So that mitral valve murmur is an improper closure of the valve between the heart's upper and lower left chambers, right? And so the tissues are too loose, or they're not connecting and closing and sealing properly. So not only do we see that with their hyperflexibility, but also in all the muscular, all the tendons throughout the body. So here again, the musculoskeletal decreased muscle tone as well. Some scoliosis could be present. Hyperextension is common, and so injuries associated with that, joint dislocation, again, weakness in that connective tissue. Also, sinus issues are common, which is very interesting. So behavioral presentation, right? Sorry, I'm gonna get a sip from the largest cup I could find. Behaviorally, we see a lot of common correlations in those with Fragile X and these specific types of behaviors, right? And so this is the stuff that we see all the time. This is the stuff where we really want to kind of intervene if we can, which we have the treatment specified for this. And we'll go over that a little bit later on. So communication delays is very common. So most boys with Fragile X have some problems with speech and language. They may have a hard time speaking clearly, difficulties with stuttering, leaving out parts of words. And the listener, the receiver of that message, may be confused or not understand exactly what that person is trying to say, which can be very frustrating for both people. They might have trouble understanding other people's social cues or tone of voice or types of body language. Girls typically don't have severe problems with speech or language, though it can be present. A lot of children with Fragile X will begin to speak later on than is developmentally typical, although most will learn to speak eventually. Most children with Fragile X have behavioral challenges. Commonly, they might be afraid or anxious in new situations. We see a large correlation between anxiety disorders and just fear, situationally based fear in people with Fragile X. Boys especially might have trouble paying attention. They might have trouble with aggression. Whereas girls might be shy around new people. They might have attentional disorders where they're hyperactive. So boys might be inattentive, and we might see girls with some ADHD hyperactivity. Again, a lot of this really overlaps with autism spectrum disorder and features of such. So something to kind of parse out if you guys have somebody in mind, you're like, something isn't quite right? This autism, it's there, but it's not all encompassing. There's something else going on. Perhaps could be this, perhaps could be a genetic issue. Again, with the behavioral, so that generalized anxiety disorder, and my colleague actually parsed out everything and did this table, and so she put whether or not it was a full mutation or pre-mutation. So remember that pre-mutation is a smaller number of repetitions, but still outside of that range of normal. And the full mutation is 200 or above repeats. So commonly in people with a larger amount of mutations, you'll see generalized anxiety disorders, ADHD, autism spectrum disorder, affective disorders, and then a range of personality disorders, which is interesting. Panic disorder here. Sensory issues. Many children with Fragile X are bothered by certain sensations, bright light, loud noises, the way that clothing can feel on their body. And these issues might cause them to act out or have some behavioral issues as well. Intellectually, there can be some delays, anywhere ranging from a learning disability, commonly all the way through a severe intellectual disability, disordered learning in math. It might affect some frontal lobe functioning, right? So having that ability to think through things, reason, learn. And because many people with Fragile X also have attention disorders, also that hyperactivity, anxiety, language processing delays, they may have more capabilities than their IQ actually suggests. So something to keep in mind with that. And so I have a video here that kind of summarizes everything that we've talked about, while also giving a quick case example, if you will. So I thought that this was interesting.
Everything is connected and affected, really.
One, two, oh,
No.
Fragile X syndrome is common. It's not only the most common identifiable inherited cause of intellectual disability, it's also the most common identifiable inherited cause of autism spectrum conditions. It affects as many as 1 in 3,000 to 1 in 4,000 individuals in its full mutation state, but it's far more common again in people who carry the pre-mutation. The most common physical feature of Fragile X syndrome is just how normal and ordinary an individual appears. This is important because people, including professionals, often mistakenly believe that if you have a genetic cause for your disabilities, then you will look different. There are some subtle aspects. The head can be slightly largish and longish, with protruding ears, which often flush with high levels of anxiety or emotion. There might be a high arched palate, which can affect speech and language, and a longish flattened nasal bridge. The chin can be quite protruding, and usually there's quite widespread lax ligaments, hypermobile joints, flat feet, and occasionally some eye and hearing problems, and perhaps even some heart murmurs.
He has low mobility. He has low muscle tone, double jointedness, that affects the way he walks,
There's a range of common behaviours and developmental aspects associated with having Fragile X syndrome. Intellectual functioning is usually in what we call the mild to moderate intellectual disability range. That's equivalent to an IQ of about 35 to 70.
His communication skills, social skills are affected. His writing, his memory, language skills, everything is connected and affected, really.
Speech and language can also be very characteristic. It can have a humorous or jocular characteristic to it. It can be quite repetitious, and it can have up and down swings of pitch. However, the communication skills are good. There's usually very high anxiety levels, which can often mediate the so-called challenging behaviours. In Fragile X syndrome, there are also often difficulties with concentration span, attentional skills, being restless, and also being very fidgety and impulsive and easily distracted. And if these features are marked, they may qualify the individual for having a diagnosis of attention deficit hyperactivity disorder or ADHD. Also, individuals, and this is very true of Fragile X syndrome, have multiple marked sensory sensitivities.
It's a different world for him to understand, and it's very challenging for us to understand what he sees, what he feels.
If we got to somewhere where it's new, God forbid if it's dark. I mean, it's not so much now, but when we're younger,
If it's loud.
if it's loud, dark, new, crowded,
Smelly.
yeah, we'd be outside for ages.
There's no doubt that individuals with Fragile X have raised rates of autism spectrum disorders. So whereas in the general population, it's only about 2% who have an autism spectrum disorder, in Fragile X syndrome, it may be as high as 20 to 30%. However, it's usually the paradoxical juxtaposition of a friendly and sociable, albeit shy and socially anxious personality in the presence of certain autistic-like features.
Once he gets used to the people, once he overcomes anxiety and the pressure of talking, two-way talking, he's fine with people.
He's beautiful hair, pink ears, pink.
He would kind of hide behind you
Yeah,
first,
yeah.
and then he'd make sure he's with you, and bit by bit he'd come
And he
out.
says embarrassing things.
Yeah.
Well, they're fine if they know them. If they're within their circle or the family circle or whatever it is, or they're with me when I meet a stranger, they're fine. On their own, they're not as good with strangers. Well, Jason, I can't say that about Jason because he'll talk to anybody.
I love being around with friends and chatting to them all and chatting to customers and things, you know.
There's a lot of confusion about how Fragile X syndrome and autism relate to each other. Fragile X syndrome describes the cause of the challenges. In technical language, what we call an etiological label. That is the cause, and there may be a range of possible consequences, one of which is autism spectrum disorder.
It's a bit like
It's a
autism,
bit like autism.
but he's not autistic.
Yeah,
I do
that's
say
right,
that.
yeah,
It's a
yeah.
bit like autism, but he's not autistic.
Yeah.
He's very personable. He
Yeah.
gets along with people. He likes to be around people.
Yeah.
There are quite substantial gender differences in Fragile X syndrome. So for males who are usually full mutation individuals, the intellectual level will often be lower than females. There may be more marked hyperactivity and inattentiveness and more pronounced autistic features. In females, it's often more subtle.
It's a very hidden, a very subtle issue, but it's massive for them, and it's a massive social barrier. And it's a massive worry for them in the future.
There's enormous variety and range in how individuals with Fragile X syndrome can present. This depends in part of the level of intellectual functioning, so that those with more severe developmental disabilities may be more prone to challenging behaviours. It's as if actions speak louder than words for that group, particularly if their verbal language isn't that well.
Sorry about that, guys. I thought I'd be able to do something and kind of watch at the same time. Well, we were almost done with that one. I'm sorry I ruined it. I was trying to see there was something in the Q&A I wanted to get to, but I won't get ahead of myself. With that, though, we will move on. I'm going to skip this one. This one is a case of example again of an individual living with Fragile X.
Andy is a very sensitive young man. He has a lot of anxiety. We have to be very careful to not put him in a situation that will overwhelm him.
Ready to go for the drive?
Yeah.
You grab your stuff?
Andy is 32 years old now. He has Fragile X syndrome. He is very attuned to people. He is all about relationships.
Fragile X is the most common inherited cause of intellectual disability. There's nothing actually wrong with people physically.
Yeah, which way should I go? That way or that way? All right.
It's your ability to develop that is itself impaired.
Andy, we gotta feed the horses. Yes, he did. Yeah. What do you want to feed the horses? Yes, he does. He loves scratches. Hi, Russ. Good boy, Millie. She's hungry.
He has wonderful relationships with the animals and with his staff.
Nose. See, Desi? He's your doggy. Hi. Yes.
People with Fragile X have a lot of repetitive, perseverative behaviors that they do.
Excuse me, Des.
They have a really strong aversion to making. You can tell they really, really want to socialize, but then they have this anxiety that comes from the actual interaction. Wear 3 hats because I am a Fragile X and I do run research programs. So, but I also treat other people with Fragile X. Good job. Andy is on some medications that are the result of a lot of the research that we've done. Well, the conventional wisdom was that in Fragile X, as you got older, IQ would actually go down. You kind of become withdrawn and lethargic. And that's not what's happened with Andy. As he's gone from being, say, 25 to 32, he's actually really blossomed.
Andy has always spent a lot of his time on his favorite couch in the living room with all of his stuff.
Oh, what's that?
Andy usually feels safest at home, but he also feels safest, I think, in the company of the people that he cares about the most.
Are you English?
I am English.
Are you English? Yes, I am.
Pick up Andy and you guys.
If I leave the decision up to him what to do, he will bring you to the teenager feeling of just driving around, having fun, goofing around.
Go baseball.
Good, I feel like the biggest thing for Andy specifically was giving him the power to choose.
You ready, dude?
Yeah. Yes, come, sir.
Something very little to most people is a lot bigger to him.
Okay, let's see if there's any good jump.
Each person that Andy looks at or talks to or spends time with, all give him something different. I provide him the outlet to be able to kind of say what he wants to say and not feel like he's being rude about it. But
Scram.
oh, that's it. I'm out of here. See ya.
I tell you.
Okay, fine. I'll stay.
I'm very sure that he would not be doing as well as he is now if we hadn't learned as much as we've learned about Fragile X.
And so, Ella? No. And you brush your teeth? You did. You didn't know my teeth. Are you telling us that?
We know what he needs. We know that he thrives outdoors, one-on-one with people who really care about him.
Yeah.
He is developing, he is maturing, he is growing. It's just slow.
I want you to hear. What did the kid do? Tomorrow, you'll see. Night. Good night.
Thanks for watching. You like
That's a great example. I think that's a good portrayal of the anxiety that you see in his dad, how he mentioned that you just see him seeking that out, but all at the same time, like pushing that away for the fear and the anxiety of it all, of interacting with others. I have one more clip here for a case example, just how they kind of discovered and found out and went through that whole process in terms of diagnosis.
My name is Kelly Randalls Coleman, and I'm from Omaha, Nebraska.
My name is Michelle Stuck, and my children are Jacob and Brianna, and also Omaha, Nebraska.
So my name is Jay Souter, and my wife Ann and I have one son. His name is Alec, and he just celebrated his 26th birthday a couple of months ago.
I have two boys, Cody and Jaden. Cody is 16 and he is affected with Fragile X. And when he was a year and a half old, he wasn't eating table food, he wasn't talking, and he wasn't walking. So we took him to about 12 different therapists, feeding clinic, doctors, pediatricians. Finally, we landed into the office of a developmental pediatrician. And after his assessment, he told us that he wanted to test Cody for 3 different things, and one of them was Fragile X syndrome. And so he was diagnosed at 20 months old. At 24 months, he started to walk and eat table food and talk. So all the therapy that we were getting him worked.
We got him diagnosed after about 4 or 5 misdiagnoses, which I think is probably a common experience for people. He was just about 5 years old when we were referred by our pediatrician at the time to Phoenix Children's Hospital, where we happened to have one of our clinics, and one of the doctors there discovered it.
For our family, the first year of Jake's life, we were told, he was just doing things slow, or, he would pick it up on his own time. After about a year of hearing that, I asked to be referred to a developmental specialist, and we've seen the developmental specialist for about 3 years, and Jake had a lot of autistic behaviors, and I was strong with thinking that's not the diagnosis for us. Right before his 4th birthday, we were referred to a geneticist. And at that time, we had met with them, and that was the first time I heard Fragile X syndrome. We went home and Googled it and looked around and had the blood test done. It took about 3 or 4 weeks to get that back. And before we even received the diagnosis back, we pretty much knew, yes, Fragile X is what Jacob has.
There was not a support group for Nebraska at that time. Through educating myself about it, I was connected with some different families. I just decided that it was really important that we start a support group.
Once they called, we kind of knew. We met with a geneticist, and they gave us contact information for Kelly's support group, and that's how we met. And they also gave me the contact information for the National Fragile X Foundation. I think since that time, we've just been
Clicked.
Yeah, like great friends. Yeah. Yeah.
So good examples there, right? And some of the individuals that they're showing with Fragile X have more features than others that you can kind of see, and others it's very kind of hard to distinguish. And I liked that one mom who said that her son was diagnosed autism spectrum, and she's like, I don't think this is us. There's something else going on. So in terms of that testing that they all had, healthcare providers generally use a blood sample to diagnose Fragile X. They'll take a sample and send it to a lab to determine what form of that FMR1 gene is present. There can be prenatal testing, or it can be done after birth. But commonly, it can be common that people don't know that they have this premutation themselves, or Maybe they actually have a full mutation but have much milder symptoms, and so they don't even know to get this testing. They're not even wondering if they're passing this on because they don't know that they themselves have anything. So pregnant women who have that pre or full mutation can pass that on to their children, as we said. And testing allows healthcare providers to detect that mutated gene in a developing fetus. It can help families and providers kind of to prepare and give them more information, and help them set up treatments and interventions as soon as possible. They can do amniocentesis. They also do chorionic villus sampling. And then in children, once a child is born and maybe someone suspects, parents kind of first notice those symptoms of delayed development. They can perform developmental screening to determine the nature of the delays. And again, do that genetic testing and blood test. So there's no single treatment for Fragile X, but there are treatments that help to kind of minimize the symptoms of the condition. Hopefully people are receiving appropriate education, therapy services, medications to give the best chance of using all of their capabilities and their skills. And early intervention is important. That the brain is still forming, and it can kind of give them the best start possible and the greatest chance of developing a full range of skills and teaching new skills, intervening as soon as possible with that neuroplasticity to kind of give wraparound services. Educationally, people with Fragile X can benefit from special ed services that are tailored to their particular strengths or weaknesses, taking into account the best learning environment for them. Most children are eligible for special ed services if they're presenting with, those cognitive or learning deficits. Also, there is quite a variety of therapy treatments. People commonly will look for speech language therapists to help improve their pronunciation of words, their sentence structure, slowing down their speech, and just using more effective communication. Occupational therapy is also beneficial. It can help find ways to adjust tasks to match a person's needs and capabilities, right? So in one of those case examples we saw, I don't know if you guys noticed, he was kind of shaking, right, as he's putting the cans into the trash bags, right? And so eating must be a struggle, right? How do we get whatever it is he's eating onto a spoon and effectively into his mouth, so that he has some integrity and respect, right? And so he's confident in being as independent as possible, right? And so hooking him up with maybe a weighted spoon, so it's a bit more effortful to get it up there, right? But it's not allowing him to shake as much. Let's see, physical therapists designing activities and exercises that can help build motor control, improving posture, balance, muscular strength. Behavior therapists try to understand why someone with Fragile X is doing what they're doing, right? If there's a lot of data that can be collected to see if there's an antecedent that can be intervened, and you're doing some structuring around that, or environmental modifications, again, strategies to avoid or prevent situations, so we can teach better or more positive ways to respond to situations. And then medication is also really beneficial. However, at this time, the Food and Drug Administration has not approved any drugs specifically for the treatment of Fragile X. But in many cases, they're used to treat certain symptoms of Fragile X. Let's see. Medication is most effective when paired with different therapies. Again, when there's kind of that early intervention, those wraparound services that they're receiving at school, at home, and in all of their environments. I have a short video here. I know one more video, right? Just about the research moving forward and how these people who are experts in the field, what they've been doing, what they're looking at, how they see the next 10 plus years, and what they're really hoping is on the horizon.
Leaders in the Fragile X field from India, Chile, and the United States reflect upon the progress that has been made and visualize what they see happening in the next 10 years for people living with Fragile X syndrome.
My own work has focused on understanding how Fragile X affects the amygdala, the emotional hub of the brain. Our initial work involved collaborations with MIT and then grew into a much larger international partnership with Professor Peter Kind and colleagues at Edinburgh. Our research in India has grown into exciting new directions, has gone beyond the traditional focus on animal models to include human neural stem cell-based assets. This is giving us exciting new insights into potentially novel therapeutics.
Over the last 10 years, since I received my first FRAXA grant, there has been an amazing progress in the field of Fragile X syndrome. However, there is still a pressing need for those gains to be translated into a effective intervention for individuals with Fragile X syndrome. In these 10 years, FRAXA DBI has been working with colleagues, academics, and the pharma industry. And I hope that in the next 10 years, all that effort and work we have all done translates into an effective treatment for those with Fragile X syndrome.
In 10 years, I visualize a world for Fragile X where Fragile X is a well-known condition and there are experts available locally that patients can access to treat the condition, where we have a number of approved treatments that work on the underlying disorder and improve core features of behavior and cognitive function, and where we can potentially combine treatments to improve function, and where we're continuing to build one treatment upon another to achieve better functioning in people with Fragile X, such that Fragile X is a treatable disorder. And perhaps we have gene therapy that we can use at younger and younger ages to result in an outcome that's more and more close to normal, where patients with Fragile X can really participate in society. And that we have programs for adults with Fragile X so that they can really be contributing members of society. And quality of life for all can be better than it is today.
This excerpt came from the Fragile X Syndrome in Pursuit of the Cure webinar that took place on World Fragile X Day 2021.
Okay. One more here. I think this is out of University of Massachusetts, some of the research that they're doing.
I'm Jeannie Lee. I'm a professor of genetics at Harvard Medical School and Massachusetts General Hospital. So for the past 20 years, my lab has been interested in the process called X chromosome activation. And this process is a wonderful model by which to understand how genes are turned on and off. And because of what we've learned in the past couple of decades, we're in a position now to be able to turn back on in a pharmacological way genes on the X chromosome that help to treat various X-linked intellectual disabilities, including the Fragile X syndrome. I'm not a stranger to Fragile X syndrome. I started my research career in Fragile X as a PhD student back in the early 1990s. And it was in fact Fragile X that got me interested in X chromosome inactivation. And so 20 years later, we've sort of come full circle in applying our knowledge of X inactivation to treat Fragile X. We are enormously grateful to the Fraxa Foundation for providing the research support that allows us and many other laboratories to continue to make progress towards a treatment to better understand the disease in general. Without Fraxa funding, we wouldn't have Dr. Lee's work.
My name is Hwan-Woo Lee, and I'm a postdoctoral researcher in this lab. And now I have been working about 3 years to study Fragile X syndrome. At the beginning, I wanted to study about this repetitive sequences, and repetitive sequences can trigger the silencing for some unknown mechanism. And I was interested to understand how this silencing happens. And then when I learned about this Fragile X syndrome, which is caused by this CGG repeat, I thought this would be really interesting to study and very important to learn and study.
We can reactivate the normal FMR1 gene in patient cells by treating with this cocktail of small molecules. And it's important to realize that there's an advantage to this strategy of reactivation because it gets at the root cause of the disorder, which is the absence of FMR1 protein. And moreover, we're doing this in such a way that we do not introduce foreign genetic material into patient cells. We're utilizing a resource that is already present within patient cells to treat Fragile X. Here we're deeply committed to pursuing a treatment for Fragile X syndrome. Fragile X has special meaning to many of us in the lab. For me personally, I began my career studying Fragile X syndrome, as I mentioned, as a PhD student in the early 1990s. And now I've come full circle. It's Fragile X that led to X inhibition, and now X inhibition is back to Fragile X. But beyond myself, many lab members here know people who have Fragile X syndrome. And in fact, I have permission to share this, but a valued member of the lab has family affected by Fragile X syndrome. So again, we're deeply committed to solving the Fragile X problem. I would say to families that not to lose hope, because I think we're in a position now to make a real difference to the lives of patients and to their families. And so we would like to take, we meaning the scientific community, would like to take many different approaches towards treating Fragile X. So we're taking the X chromosome reactivation approach, but there are many other ways. There's gene therapy, there's gene editing, and I think it's important for funding agencies to actually support all of these different methodologies because at the end of the day, it may be that we need all of them in order to make a difference to patients. Lastly, I would like to thank both the Fraxa Research Foundation and the Pierce Family Foundation for their generous support of our Fragile X research.
Okay. So hopeful moving forward and fascinating that's where the research has led, and they could potentially just replace that FMR1. Currently the NIH has approximately 84 studies relating to Fragile X, and about half of them are about the evaluation and the effects of metformin, which is a diabetes drug, on Fragile X patients. There's also studies out there evaluating the effects of behavioral interventions, parent training on aspects of behavior, general understanding of the syndrome, and using supplements to see how to curtail some things. And I was wrong before I said that she was from University of Massachusetts, but she was at Massachusetts General Hospital through Harvard. And again, what they're looking at to produce the normal protein product within FMR1. And let's see, Cincinnati Children's Hospital exploring the use of a virus to get the deficient protein where it needs to go. And looking at other FDA approved drugs to treat Fragile X and its syndromes. So I also have some links listed here. If you want more information or places to go to search for support, guidance, I'm happy to also answer any questions or to help kind of brainstorm ideas with what you have going on with the people that you support. I'm happy to brainstorm that with you. So I have Fragile X links here and then some more general links for genetic disorders, but that'll kind of lead you. So why don't we take, so almost 2, why don't we come back at 2:10? However, in that time, if you guys have a question, if you can either pop it in the chat box or the Q&A and then come back at 2:10 and then we can kind of go through those and discuss those. I will see you guys in 10. Thank you. Okay, hi again, everybody. Okay, so during that small break, I was able to go through the Q&A and just the chat box and kind of receive some of the questions or comments. And as Anna just pointed out, the CEs will be sent out within the next 14 days or so. So be checking your email. And then her Danielle's contact information is listed below. It's DAILEY at hope.us. And so she's your contact if you haven't received anything. I'll also be sending my slides to her. And so she'll be sending that information along with your CEs at that time as well. And then some of the other questions, people wanting to know my name and email. So I included that as well, but I'm Kelly Jensen. And I'm a psychologist with the Illinois Crisis Prevention Network. And my email, again, I have it listed in the chat, but it's KJENSEN at trinityservices.org. Please feel free to reach out if you have further follow-up questions or just want to speak privately. That's great. Another question was, are there organizations or groups specific to Fragile X in Lake or Cook County where we can refer families with adult children so that they can connect with other families for support, social interaction, etc.? There are actually. It's actually the best, most expansive one is the Greater Chicago Fragile X group. And they're kind of hubbed out of Chicago, but they do have some in the northwest suburbs as well. Again, that's the Greater Chicago Fragile X group. And then there's another one, Unifying the Chicago Links groups, NFXF. So the Fragile X Links, LINKS group of Greater Chicago. And those are two of the larger ones. Let's see, any resources you would recommend for working with clients with Fragile X and assisting with initiation of coping skills and identifying triggers? For this one, I would say, first of all, collecting data would probably be the most important, right? So going and doing your observations, the anecdotal data is great, but trying to nail down some ABC data, that antecedent behavior consequence, right? So what's happening immediately before the behavior? What is the behavior? What does it look like? Duration, severity, etc. And then what was the consequence, right? Did something get taken away? Were they sent to a timeout? I mean, I'm thinking of children here. Did they immediately get attention and actually maybe reinforce that behavior? So collecting a lot of that good ABC data can really kind of help identify those precursors and those triggers you're looking for. You can also do a functional analysis to see kind of what's maintaining that behavior, right? So are they doing this for attention, escape? Is it tactile, pain? All of these things can be really useful. Another question was, so how would it be more severe for males than females? And so for that, I'm actually going to share my screen again. And I'll pull up this sweet little chart. Okay, go. Okay, so how would it be greater for, how would the severity of the Fragile X presentation be greater for males than it would for females? So even if one of the female's genes is affected, so if you can see my mouse here, let's go here, right? So this girl is affected, right? You can see it right here on her X chromosome. She has that mutation on the FMR1 gene. She also has this other X that does not have the mutation, right? And so that chromosome is able to potentially make up for or kind of contribute to the lack of the protein here, and can kind of substitute and making it less severe, milder symptoms. Right. And so over here, this guy, a boy who's affected, he only has one X chromosome, right? And then a Y. So he has nothing to compensate for this. And so he's going to present with more severe symptoms, if that makes sense. Oh, you couldn't see my mouse. Great. Sorry. Within the page that I was just sharing, I was just kind of pointing at those chromosomes themselves, looking at the daughter and the son. Somebody raised their hand. Let's see. Nicole Riley, maybe that was an error. I don't know. Nicole, if you have a question or comment, you can go ahead and type it either into the chat or into the Q&A itself. If anybody has anything else, again, please feel free to reach out. I'm happy to connect you with further resources or kind of figure out what's going on behaviorally, medically, to hook people up with some geneticists as well. So thank you guys all for your attention and for your patience in this. All of this is still so weird to me. So thank you for your time. I hope that you guys learned a little bit more about Fragile X. So everybody stay safe. Happy holidays and be well. Bye-bye.